In 2014, Médecins Sans Frontières, Doctors Without Borders, deployed teams on an unprecedented scale to fight the largest Ebola epidemic in history. But the high-profile nature of this crisis shouldn't overshadow the other medical needs we attended to in countries around the world, from South Sudan to Palestine, from Ukraine to Iraq. As an example of some of the work MSF undertook in 2014, teams provided emergency medical care to victims of violence, treated people suffering from illnesses such as HIV, tuberculosis, malaria and cholera, helped mothers deliver their babies, offered mental health consultations, and ran vaccination campaigns for preventable diseases such as measles and meningitis. MSF ran projects in 63 countries, and what follows is a summary of key events that shaped 2014.
I like that. A baby that cries at me is a baby that has energy.
An Ebola epidemic was officially declared on the 22nd of March, and the virus coursed rapidly through Liberia, Guinea and Sierra Leone in a geographical spread never seen before. Soon, Mali, Nigeria and Senegal were also affected. On the 8th of August, the World Health Organization finally declared the outbreak a public health emergency of international concern. But the aid provided was still insufficient. On the 2nd of September, MSF appealed to the United Nations for more help.
It is your historic responsibility to act now. To put out this fire, we must run into the burning building.
By the end of the year, the World Health Organization reported over 20,000 confirmed Ebola cases and nearly 8,000 deaths. MSF sent thousands of staff to work in the affected countries, dispatched tons of supplies and admitted over 7,000 people to Ebola management centres. 2,200 people recovered from Ebola and were discharged from MSF management centres. As the Syrian conflict grew more complex, entrenched and divisive, civilians remained trapped amid the violence. MSF should have been running major projects in Syria throughout 2014, but without security guarantees for staff and no access to government-controlled areas, this simply wasn't possible.
On a une situation qui ne fait que s'aggraver parce que les combats continuent de manière intense. Les structures de santé continuent d'être ciblées par le régime. Donc on a un système de santé qui s'est complètement écroulé.
Despite closing medical facilities in Islamic State group-controlled areas due to the kidnapping of MSF staff in January, we continue to operate 3 hospitals in the north, a specialist burns unit in Idlib and 2 hospitals in Aleppo, all staffed by Syrian colleagues. Projects also continued in Jordan and Lebanon, working with Syrian refugees and host communities. The extreme violence and persecution in the Central African Republic caused millions to flee their homes in 2014 and resulted in a massive influx of refugees to neighbouring countries such as Chad and Cameroon. In response to the crisis, MSF doubled its medical assistance and started running additional projects for Central African refugees in neighbouring countries. The continued violence in South Sudan also forced people from their towns and villages, and by the end of the year it was estimated that 1.5 million people were displaced in the country. Hundreds of thousands of people were denied life-saving assistance when medical care came under attack. Patients were shot in their beds, hospitals were looted, wards were burned to the ground, and medical equipment stolen. Despite the challenges, MSF is constantly striving to provide assistance to those who need it most. Our role is to save patients' lives, and we respond to crises with that at the forefront of our minds. We could not work in this way without our supporters and our teams around the world. We want to take this opportunity to thank them.